Oh my gosh. Good afternoon, New Brunswick. I'm Vicki Hogarth, and you're watching the New Brunswick COVID-19 update with Premier Higgs and Dr. Jennifer Russell on CHCO television. We've just done the journalist roll call for the conference, so we should be starting any minute now. Just for a recap of where we're at, we will find out the numbers for today's conference in the conference along with you. Yesterday we had 6 new cases in the province, and they were all over the place. There was 1 in the Moncton region, 1 in the St. John region, 1 in the Fredericton region, 1 in the Edmundston region, and 2 in the Bathurst region. That's brought us to a total of 119 active cases in the province currently, 514 in total since the pandemic began. We're just shy of, I believe, 128,000 tests that have been done so far. Now, what we learned about earlier this week was a super spreader event that happened in November in the St. John area in Zone 2 that was responsible for 80% of the cases in Zone 2 right now. 34 direct cases came from that event and 60 in total. And I believe there are around 80-ish cases currently that have come from the recent orange level of recovery that we're experiencing right now. I don't know what the case count is today. We will find that out along with you. Dr. Russell is usually the first to speak, and she gives us those numbers right off the top of the conference. Premier Higgs will be joining us today. Earlier this week, it was Dominic Cardy, the Minister of Education. So this will be the first time this week that we are hearing from the Premier again. So it is quite a busy conference. I imagine the journalists will have probably one question each, possibly a quick follow-up, but it could be just a 1-question limit today. There's still journalists actually joining the line right now. I'm interested in finding out what you would like to hear from Dr. Russell and Premier Higgs. If you have questions, you can email them to me at news@chco.tv, or if you're watching online, if you're enjoying the Facebook stream right now, and I also keep it on my computer where I'm following what you're saying as this is happening so I can hear from New Brunswickers about what your questions and concerns are. I do follow everything that you write and try to incorporate all of your questions and concerns into the questions that I ask in the conferences. Obviously, when there's just 1 or 2 questions per conference, it takes a while to get to everything, but I do keep them on a master list in the office and try my best to get an answer either in the conference or outside of the conference just through email, through public health. As I mentioned, for those of you just joining us, yesterday we had 6 new cases in the province. They were all over, actually. There was 1 in Zone 1 in the Moncton region, 1 in Zone 2, the St. John region, 1 in Zone 3, the Fredericton region, 2 in the Bathurst region, and 1 in the Edmundston region. We don't know the case count today, but as of yesterday, there were 119 active cases in the province, and we still have 3 zones. Zone 1, 2, and 3 are still in the orange level of recovery. If you'd like to share online about how you're adapting to this rollback, if you are in one of those zones, I appreciate hearing your concerns on those issues as well. I know last conference we asked about carpooling, especially if you're in a rural area. That has been a concern. Many people in rural areas rely on carpooling to get around since there isn't public transportation, and Dr. Russell explained it was newly added to the website, the strategy to go about safely carpooling while you're in an orange level of recovery. If you wear your mask while you're in the car and disinfect and follow proper protocol, it can be done safely. I'd love to hear what your questions and concerns are for today. If you are used to joining us in these conferences, you know that sometimes we start a few minutes late depending on how quickly they're able to get going. So we should be along in the next 10 minutes or so, but I am following what you are writing on Facebook right now, and I encourage anyone who is following on Facebook to share your comments and concerns. It's been a great way for us to feel like we're still communicating with New Brunswick while we're in these single-family bubbles right now. It's been a great way, these conferences, for me especially, to feel like I'm still connected to my fellow New Brunswickers and to hear what your questions and concerns are. And again, you can email them to me as well. I do check the news@chco.tv website. You can email me directly at Vicki, VICKI, .Hogarth, HOGARTH, @chco.tv as well. I also check the messages on CHCO's Facebook webpage as well. So if you'd prefer to send a message there, I'm also friends with so many of you on Facebook, so I will respond to direct messages as well. If it takes me a day or so to get to them, I do my best to get to all of them by the end of the day, but I do check them all. So if you ever have a question or concern, I might not be able to answer it, but I'll at least hear from you what they are, put them into my master list of questions to get answers from in these conferences, and hopefully have an answer for you within a matter of days or weeks. I'm curious to hear how people are preparing for the holidays as well. I know we still don't know if there will be a return to yellow for zone 1, 2, and 3. I am currently in zone 2 in the St. John region, and while we're based in Charlotte County, which is more rural, the whole zone has rolled back into the orange level of recovery. And it's definitely been an adjustment after having spent so long in the yellow phase of recovery, but it's been well appreciated that there have been modifications made to the orange level of recovery this time around, which include allowing people to still experience restaurants and stores and to keep businesses going. But I still like to hear from you whether you find those modifications positive or negative, and what the effects have been on your life during this time. Again, if you are just joining us, we can do a quick recap of everything we know at this point. We still don't have the case count for today. When it is a day where there is a conference, we find out along with you what the case count is. We don't get a press release prior to the conference to tell us what that is. So as Dr. Russell explains what the new case count is, that's when I find out as well, and all the journalists on the line. So we don't know what it is for today, but I can say that there were 6 cases yesterday, and while I know all of us who have been in zone 2 have been used to having quite a large case count since the super spreader event, there was actually just 1 in the zone 2 area yesterday, as well as 1 in zone 1 in the Moncton region, 1 in the Fredericton region, 2 in the Bathurst region, which is zone 6, and 1 in the Edmundston region, zone 4, which we haven't heard cases from in a while. They are all under investigation, so I don't have word yet if any or all of those are travel related or connected to the super spreader event. I am sure we will hear more today as we hear from Premier Higgs and Dr. Jennifer Russell. This week we also heard from Minister of Education Dominic Carter a couple of days ago about how this is affecting schools. I know there were changes to the orange level of recovery in terms of sports practices. I'd love to hear in the Facebook chat how that's affecting your life or the life of your family members and friends. So please, I encourage comment, and I do follow once the conference starts. I'll be following along. I'm looking at it now. I'm not reading everything, but I do see there's quite a lot of talk already. And I really do appreciate hearing from you during the conferences what your questions and concerns are and how it is affecting you, especially as the holiday season is approaching. It's definitely been a dramatic change, the orange level of recovery. For the 3 zones that are in it currently, it has been a bit of adjustment, especially as the time changes and the winter rolls in. It can feel quite lonely, very isolating. I know the feeling, trust me. It's been hard to not see the family that I do have here, and very difficult to know that there won't be some family members we will see at the holidays this year. But knowing that there's a vaccine in sight, in the UK they will be implementing the vaccine next week. That's the Pfizer vaccine. They were the first country to approve the use of the Pfizer vaccine, or I believe of any vaccine. So it'll be curious to follow that in the news and to see how the implementation of the vaccine goes, and what the results are and how many people they're able to vaccinate, and what the order will be in terms of, we don't know fully the rollout of how it will go. I know that that's definitely on the minds of people across Canada right now, is how and when and who will receive the vaccine first as it comes to Canada. I don't believe we will be starting vaccinating anyone till early, the conference is about to start. I see that Bruce, the moderator, is definitely in the conference room, so we should be starting shortly. I know that if you've been following these conferences since, we're about to start, I will join you afterwards.
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Les personnes suivantes prendront la parole lors de la séance d'information de cet après-midi. La Dr. Jennifer Russell, médecin hygiéniste en chef, et le Premier ministre de Nouveau-Brunswick, l'Honorable Blaine Higgs. Dr. Russell.
Thank you, Bruce. Merci. Good afternoon, everyone. Bonjour à toutes et à tous. Aujourd'hui, je discuterai des questions suivantes. L'état de l'éclosion dans la zone 5, une mise à jour au sujet du complexe Parkland St. John, notre gestion de la pandémie dans le sud et l'ouest du Nouveau-Brunswick, la définition des déclencheurs, les façons de planifier d'heureuses fêtes en toute sécurité en ce temps de pandémie de COVID-19. Today, I will be speaking about the Zone 5 outbreak status, Parkland St. John update, our management of the pandemic in southern and western New Brunswick, and the definition of our triggers, and how everyone can plan for a happy and safe holiday season in this time of COVID-19. L'éclosion de la COVID-19 qui s'était déclenchée dans la zone 5 le 9 octobre dernier est officiellement terminée. La zone 5, sur la région de Hamilton-Restigouche, était passée à la phase orange au début du mois d'octobre à la suite d'une croissance marquée du nombre de cas dans cette région et de l'augmentation du nombre de cas dans la région voisine du Gaspé au Québec. Grâce à la collaboration et à l'appui des citoyens de la région de Hamilton, nous avons réussi à ralentir la propagation de la COVID-19 et ainsi à permettre à la région de revenir à la phase jaune le 5 novembre. As of today, the Zone 5 COVID-19 outbreak that began on October 9th is officially over. Through the cooperation and support of the people of the Hamilton region, we were able to slow the spread of COVID-19 and move the entire area back to the yellow level on November 5th. Since then, public health has monitored the situation through 2 14-day incubation cycles. And we are now confident that the outbreak is over and existing measures are sufficient to maintain the area's yellow level status. And I would really, really like to thank everyone in the Hamilton-Restigouche region for their commitment, their patience and vigilance in slowing the spread of the virus. It really was a collective effort. And everyone who self-isolated when directed, who avoided large gatherings, they wore masks and maintained physical distance, and it really did make it possible for us to limit the impact of this outbreak and bring it under control quickly. So, les dirigeants à l'échelle locale ont également joué un rôle crucial en tenant les citoyens informés au sujet des exigences de la phase orange. We literally could not have done it without you. It allowed us to learn from that outbreak and that situation. All the learnings that we took away from that, I feel very positive about. And I want to thank that all the leadership, the media outlets, et cetera, who really did work collectively to allow us to take that opportunity and learn from it for the other outbreaks that we are seeing now. Another round of testing of Parkland St. John residents and employees was recently completed. The results are as follows. All the residents tested negative. One employee who has been off work and isolating for 9 days tested positive. And I can tell you that another round of testing will occur at the independent living section tomorrow and the nursing home next Tuesday. Therefore, to date, there are 16 confirmed cases at Parkland St. John, 6 employees and 10 residents. The other day, I acknowledged the excellent collaboration between Parkland St. John and the extramural program folks and the Ambulance New Brunswick folks, who are the members of the prompt team, who have been on site to ensure testing and support and infection prevention measures, along with working with the public health team. But I would also like to give a shout out to all the other players that I inadvertently missed, including the social workers. So thank you for all of your hard work. De nouveaux cas de COVID-19 continuent d'être signalés dans l'ensemble de la province. Il s'agit d'une réalité que nous devrons gérer jusqu'à ce que nous ayons largement accès à nos lots de vaccins approuvés par Santé Canada. Et c'est-à-dire, je crois, le message qu'on reçoit, c'est d'ici à un an d'ici, on espère que la population de New Brunswick, au moins 75% de nous auront tous reçu le vaccin. Zone 1, 2, and 3, covering most of southern and western New Brunswick, our three largest cities, and the majority of our province's population remain at the orange level. And while we are seeing some progress, again, which means that people are following public health advice and measures and recommendations, these zones will remain in orange while we evaluate the effectiveness of the public health measures announced last month. So it usually is a 2-week time frame that we put the restrictions in, and then we assess. And so that's how we're approaching these zones in the orange level right now. And as we make those assessments, there are a lot of moving pieces involved when making a color alert decision. And I know that there is confusion around the triggers that we have online. So I just wanted to clarify for anybody wondering that this document is what triggers us to conduct a risk assessment. And although the risk assessment may lead to a decision to change a zone's color alert, the triggers themselves are not the risk assessment and should not be viewed as such. So for instance, the decision to move to Zone 3 to orange was based on the region meeting the following triggers. There was a confirmed case in a high vulnerability setting, such as the Dan Cassidy Center. There was also another vulnerable setting there as well. Noted low compliance to public health measures in Zone 3. We had information from Department of Public Safety around the compliance for mask wearing, so that was part of our risk assessment. And because of the backlog that we experienced in some zones, the health system wasn't able to screen and test at the required number of symptomatic patients in a timely manner. And I can tell you that Public Health will be conducting another risk assessment this Sunday to assess Zones 1 and Zones 3. Aujourd'hui, Santé publique confirme qu'il y a 6 nouveaux cas de COVID-19 au Nouveau-Brunswick. Il y a un cas de zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Une personne âgée de 30 à 39 ans. Il y a 3 nouveaux cas dans la zone 2, soit la région de St. John. Une personne âgée de moins de 19 ans, une personne âgée de 30 à 39 ans et une personne âgée de 60 à 69 ans. Il y a 2 nouveaux cas dans la zone 3, soit la région de Fredericton, 2 personnes âgées de 60 à 69 ans. Il y a présentement 111 cas actifs de COVID-19 au Nouveau-Brunswick, mais aucun d'entre eux n'est hospitalisé. Je vous demande d'accompagner ces personnes dans vos pensées et vos prières aujourd'hui. Today, Public Health has confirmed 6 new cases of COVID-19 in New Brunswick. In Zone 1, which is the Moncton and Southeast New Brunswick region, there is 1 case, an individual aged 30 to 39 years of age. In Zone 2, which is the St. John region, there are 3 cases, 1 individual under 19 years of age, 1 individual 30 to 39, 1 individual 60 to 69. In Zone 3, the Fredericton region, there are 2 cases, active cases of 2 people between the ages of 60 to 69. Hospital. There are currently 111 active cases of COVID-19 in New Brunswick with no individuals in hospital. So I ask you to keep all of these people. And my understanding is the last count, there were about 1,500 people in self-isolation. So I ask you to keep all of these people in your thoughts and your prayers today. We really feel that this holiday season will be different. We've all been thinking about the holidays lately. Given the surge of COVID-19 across North America and around the world will be different. This isn't really the year to be able to spend holidays given the surge of COVID-19 across North America and around the world. This isn't really the year to be able to spend holidays in an exotic location. Ce n'est pas non plus l'année de quitter la province pour
à
rendre
venir
visite
passer
à des
des
membres
fêtes
de la
avec vous.
famille, ni pour
Le
inviter
temps
des
des
membres
fêtes
de la
peut quand
famille
même
qui habitent
être
à l'extérieur du
une période
Nouveau-Brunswick
festive,
à venir
remplie de
passer
joie
des
et
fêtes avec
d'amour,
vous, en gardant tout le monde
Le
en
temps des fêtes
sécurité.
peut quand même être une
Nous
période
pouvons y arriver si nous
festive,
planifions
remplie de
à cette
joie
fin.
et d'amour.
En gardant
If
tout
we
le
start
monde en
planning now for
sécurité.
creative ways to
Nous
mark this
pouvons y
holiday season,
arriver
I
si
feel
nous
that we can be
planifions à
successful.
cette
We're
fin.
just putting out some new
If
information
we start
online
planning
about
now for
our,
creative ways to mark
advice
this
around
holiday season,
celebrating
I
the
feel that we can be
holidays.
successful. We're just
And I
putting out
would
some new
ask
information
that you
online
focus
about
on what you
our
can do rather than
advice
missing
around
out on what
celebrating
you
the
can't.
holidays.
I can tell you
I
that
would
the medical officers
ask that you
of health
focus
in
on what you
New
can
Brunswick
do
right
rather
now,
than
again, are
missing out
are-
on what you
are
can't.
working very hard to keep
I can
the
tell you that
outbreaks
the medical
are in
officers of
existence
health
under
in
control
New
right
Brunswick right now,
and
again,
certainly the hope is that they are under control and we can have a safe, positive messaging around what to do safely during the holiday season that doesn't jeopardize having schools and businesses open in January. So we want to strive to keep everyone safe and healthy by protecting yourselves and those around you. Start by keeping your gatherings small, and I cannot emphasize this enough. Keep your circle of contacts consistent and small, no matter where you live in New Brunswick. I don't think there's any outbreak up to this point in time that hasn't involved large number of close contacts. And so this is the marching call, the call to action for everyone this holiday season. Keep your number of close contacts extremely small and consistent. Il y a moins de restrictions s'appliquent dans les régions qui se trouvent à la phase jaune, mais je recommande à chacun de limiter autant que possible le nombre de contacts étroits. The majority of confirmed cases of COVID-19 happened when people were within 2 meters of an infected person without wearing a mask. And so what we know is that masks are very important. They are one of the several measures of protection, layers of protection that include social distancing, hand washing, border measures, proper self-isolation, getting tested when you have symptoms, keeping your number of close contacts small. So it is one of many things. It doesn't work alone by itself. It has to be accompanied with all of the other measures to prevent the spread of COVID-19. So overall, we really are just focusing on what we know about the transmission patterns that we've seen and what we can do to prevent them. So now more than ever, we need to maintain these practices that slow the spread of COVID-19. And I do just want to acknowledge the frustration and challenges and sacrifices that people are making today in New Brunswick. For a population of 750,000 plus people to only have 500 plus cases compared to other provinces like Manitoba, Alberta, Saskatchewan, British Columbia, Ontario, and Quebec, they're living a very different reality right now with respect to COVID-19 than we are. And I'm so grateful to live here in New Brunswick at this time. My heart goes out to the other provinces who are not having the kind of success that we are having. And what we've achieved so far has been a collective effort, but to maintain that success, it will continue to be a collective effort along with frustration, sacrifices, and hard work. Public Health has advised against non-essential travel this holiday season, but if you do decide to travel, be aware the case counts in other jurisdictions are much, much higher than here in New Brunswick, which means that if you do travel and you come back, you will have to self-isolate, and the risk of you bringing COVID-19 with you when you return is higher. So helpful hints if you are going to travel. Wear a mask at all times, follow physical distancing rules, especially in airports and other indoor locations. Travel only with the members of your immediate household. Don't travel at peak hours and avoid layovers whenever possible. Don't plan long car trips with multiple stops, and download the COVID-19 alert app to your phone. Santé publique a déconseillé les voyages non essentiels pendant les temps de fête. On sait que les nombres de cas dans les autres provinces, les autres pays sont vraiment, vraiment hauts maintenant comparé à ici au Nouveau-Brunswick. Alors, ça veut dire que le risque est élevé quand vous voyagez et le risque est élevé quand vous retournez. Et c'est vraiment important que vous faites le 14 jours d'auto-isolement quand vous retournez. Si vous décidez tout de même de voyager, voici quelques conseils utiles pour vous protéger et protéger les autres. Portez un masque en tout temps et respectez les consignes de distanciation physique, surtout dans les aéroports et tout autre lieu à l'intérieur. Voyagez uniquement avec les membres de votre bulle immédiate. Ne voyagez pas aux heures de pointe et évitez les escales autant que possible.
Ne prévoyez pas de longs déplacements en voiture qui comprennent plusieurs arrêts. Téléchargez l'application Alerte COVID-19 sur votre téléphone. Those who travel to New Brunswick must self-isolate for 14 days upon arrival and may not have contact with others during this time, including members of their family. If the visit is shorter than 14 days, then the whole time must be spent in isolation. And ideally, those who are self-isolating would be in an environment with access to a separate bathroom from others, like in a hotel. And obviously, the ideal situation is to isolate in a separate location. However, I understand that staying in a hotel for 14 days is not possible for everyone, or you may not have access to a home with more than one toilet. In those cases, it is even more important to follow public health guidance. Each time the bathroom is used, clean high-touch surfaces like taps, light switches, door handles, and practice good hand hygiene. There are more guidelines on our website, and I encourage anyone who has questions to visit the self-isolation page on our coronavirus website. You should not be choosing to self-isolate when an arriving family member as this introduces some risk, so only do so if full isolation is not possible. And I know this season has, in the past, been a time to gather and share meals and songs and stories. But this year, I urge anyone who must self-isolate to think about where it would be best to do that. Think of the members of your family that you could make sick. Think about the community that you may infect. And think about the healthcare system in New Brunswick that is handling the current needs, but could become overwhelmed by rapid case increases. We must do these things to keep COVID-19 at bay, because the alternative is more sickness and hardship in the new year. And I know it is difficult, but it is necessary. And I'm not suggesting that we skip the holidays this year. I challenge everyone to embrace and celebrate the holiday season in new and unique ways. We can't make merry as we've done in other years, but we can still make memories. Organize a Zoom house party. Invite your friends to celebrate with you virtually. Pick up the phone and call someone you haven't talked to in years. Sortez dehors, faire de l'exercice et prendre de l'air. Essayez un sport d'hiver que vous n'avez jamais pratiqué auparavant. D'abord et avant tout, prenez soin de vous-même et prenez soin des autres. Même sans la COVID-19, de nombreuses personnes se sentent tristes et seules durant le temps de fête. Faites preuve de gentillesse et de compassion à l'égard de ceux qui vous entourent. Even the smallest gesture can go a long way in reducing your stress and raising spirits for all. The joy of the holiday season is ours for the taking, and I urge all New Brunswickers to have a happy, fulfilling, and safe holiday season. Merci. Thank you.
Bonjour, good afternoon. Before we begin today, I'd like to say that my thoughts are with everyone who has been affected by the heavy rainfall over the last few days. Our Provincial Emergency Measures Organization has been working closely with municipal EMOs to coordinate their response to this storm. Merci aux services d'urgence qui ont aidé les gens dans le besoin et qui se sont assurés qu'ils n'avaient pas de blessures graves. Je suis reconnaissant pour l'incroyable esprit communautaire des gens de Nouveau-Brunswick et des bénévoles qui sont venus aider les gens touchés par les inondations. While we don't have a complete picture yet, we know there has been severe damage in the Sussex and Sussex Corner areas. At least 30 households have received accommodation and support from the Red Cross. A healthy and safe inspection team is in the Sussex area to evaluate homes and businesses once they are safe to enter. And New Brunswickers must register to get a free inspection. You can register and support damages by calling 1-888-292-8555 or online at snb.ca/EMO. In recent days, we have seen decreased numbers of cases of COVID-19 in our province. 3 zones, however, remain in the orange level, and New Brunswick have clearly taken very seriously this situation. We need to keep up that good work in the days and weeks ahead so the whole province can return to yellow into the yellow level as soon as possible. In speaking with public health, they continue to reassess the situation. And we're all hopeful that we can turn soon to the yellow zone. And these discussions, when the time is right, and hopefully sooner than later, we will be able to meet with COVID Cabinet and Cabinet Committee to make a final decision. But this all depends on how successful we continue to be in our diligence to protect one another and ourselves. I am hopeful that the Zone 1, the Moncton region, and Zone 3, the Fredericton region, will soon be able to go back to level. I know at this time, St. John region, Zone 2 is a bit behind because of the significance of the pandemic, but we're all hopeful that, we can see changes in the coming days. It may take a bit longer in some cases I mentioned in the St. John, but we know how we got there. We know why we've been in this situation for the last couple of weeks. Let's not repeat that. Dr. Russell spoke of the opportunity and us to have a different Christmas. Well, we'd much prefer to have a yellow Christmas than an orange or a red one. I know that the opportunity exists for us, unlike it exists in other provinces, as we've seen. We can get back to the norm in COVID. We know that vaccines are just around the corner. So we just have to be diligent. So let's prepare for Christmas, but let's not get impatient. Let's make sure that we can get back to yellow. Les agents d'application de la loi font de la surveillance dans les entreprises et l'espace public sur une base régulière. Ils donnent également des conseils sur la meilleure façon de protéger les gens de Nouveau-Brunswick contre le COVID-19. During recent inspections, enforcement officers reported that 98% of the people they observed were wearing masks. I know this surveillance has been challenging for all of us. We got complacent, and that's why we ended up in the orange zones over this past several weeks. We do not want to get complacent again. And I know, although it's frustrating, it's a small price to pay for us to get back into yellow, to once again get back to enjoy our families, but do it in a COVID respectful way, in reinforcing and following public health recommendations. I am convinced we can be there sooner than later. So although I've got complaints too about our enforcement mechanisms, our enforcement officials, I just want you to put yourself in their shoes. They are going around the province, they're taking directly some of the abuse, which isn't always helpful, but they're just trying to do their job. They're just trying to let every one of us understand how important it is and what the role that each one of us play in ensuring that we can get back and get through this safely. We don't want to lose it now. We've received a number of questions about the need for a one household bubble in the orange level, and I'd like to address those concerns. Nous comprenons que les règles concernant le boule formée d'un seul ménage pour les régions dans la phase orange est difficile pour la population. Mais c'était une étape nécessaire parce qu'il y avait des cas reliés à des personnes qui se résilaient dans des maisons sans porter de masque et sans respecter la distanciation physique. Les entreprises sont autorisées à demeurer ouvertes, uniquement en raison des restrictions qui sont en place, comme la distanciation physique et le port de masque. This rule was introduced because while we have not seen significant community spread through businesses and public spaces, we have seen a number of cases originating from close contacts who were spending long periods of time together. Nous savons qu'un vaccin sera disponible bientôt. Nous préparons un plan pour que ce vaccin soit distribué aux gens de Nouveau-Brunswick de la manière la plus efficace possible, tout en assurant un équilibre entre les répercussions sur la santé, la société, et l'économie. By the time a vaccine is approved federally, we will have a plan in place to deliver it as efficiently as possible, taking safety, security, and resiliency into account. I am pleased to announce that Greg McCullum, the Director of New Brunswick Emergency Measures Organization, will take the lead on this plan. He has experience and the expertise to ensure we deliver the vaccine to the highest priority groups, such as the elderly, people living in long-term care homes, and frontline healthcare workers, and to do it as soon as possible. The vaccine plan will help us set priorities for vaccinations while balancing health, society, and economic impacts. The plan will establish supply chains and logistics. We will create a delivery system that meets New Brunswick's needs. I'm excited about seeing the finish line, and I'm sure many of you are. I'm not excited to the fact that my family can't come home and visit this Christmas as well. And believe me, I've heard it more than once from my wife, Marcia. So we have 3 grandchildren in Guelph. We have 2 daughters, but obviously the daughter in Guelph and her husband, and the 3 grandchildren, and a daughter and her husband in Saskatchewan, neither who will be coming home for Christmas. My mother is going to celebrate her 100th birthday, and will likely, a lot of that will be online celebrations for many of my family members. So I'm hoping to get back in yellow as well, so we can have some resemblance of family getting together. So every one of us will play a role in just how much of Christmas we'll enjoy together amongst our collective family members. But it's urgent right now that we don't lose focus. We don't become complacent. Does that mean you can't go out and shop and be excited about Christmas and put up your Christmas tree and be ready to celebrate when we turn to yellow? No, it doesn't. Does it mean that we should just wait for a vaccine and not try to live with COVID the way we have been under the rules of public health? No, we shouldn't just sit and wait. Let's make the most out of a Christmas with COVID. It's going to be a unique time in history. We're all going to look back on this time that we shared together in New Brunswick. We're going to look back and say, wow, I was there in 2020. I was there doing my part. And New Brunswick was one of the best performing provinces in the entire nation because I did my part. And I worked with people that were in the healthcare field, whether it be public health, in the enforcement field, and I worked with my neighbors, and I protected myself and each other. Together, we won't not only beat COVID, we'll be ready for the vaccines when they come, and they're just around the corner. So let's have a Christmas season like we've never had before, because that's where we are right now. But let's have one that we look back with fond memories, memories that could only be created during a pandemic and at a time in our history like we have never seen in the past. Thank you. Merci.
Merci beaucoup, Monsieur Premier Ministre. Thank you, Premier. Thank you, Dr. Russell. Merci beaucoup, Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. S'il vous plaît, voulez-vous assurer de désactiver le Monsieur Premier Ministre. Thank you, Premier. Thank you, Dr. Russell. Merci beaucoup, Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. S'il vous plaît, voulez-vous assurer de désactiver le son de vos micros? Chaque journaliste peut poser une question. We'll now proceed with questions from the members of the media. Each reporter will have one question. Please ensure your microphones are placed on mute, and you have the right to pose your question in the language of your choice. Silas Brown, Global TV.
Thanks, Bruce. This is for Premier Higgs. We've seen recently that opposition parties and advocates have been calling for an eviction freeze and, in some cases, some form of rent control to prevent people from being unhoused at a time when people are being asked to stay home as much as possible. It's something that Nova Scotia has recently done through the emergency order, and I'm curious about what your feelings are on the need or lack of need for an eviction freeze and potentially rent control?
Well, certainly as with any situation or reaction thereto, I always like to understand the facts and the rationale behind it. And I know there's lots of, we can always have a case or one-off case or situation that may be reflective of a general situation or may not. But in relation to, the cases of evictions, if we actually look at the statistics for 2020, they're currently lower than in previous years. So this is of 10 months, and we're certainly running now at 22 on the 10-month cycle. It could be a few more, we'll look at that over the end of the year. 2019 had a total of 25. These are a percentage evicted. There's different categories here. So if I look at the total requested, I guess is the most simple way to put it. In 2018, there were 1,688. 2019, 2,518. And to date, in 2020, it's 1,525. So we're monitoring that to see what is real. We've been talking with landlords to understand, what has been the rent situation, what has been the evictions. And so we're analyzing right now the stats, and we'll decide how to react based on what the situation really is. We know that there are new buildings going up. We know that there are renovations going on in apartments, but we're being told by the landlords that the general rent rates are that the rental rate increases are low. Anyway, we will pursue to understand that before we react on a policy that may have been necessary somewhere else and may or may not be necessary here.
Thank you, Premier. Thank you, Mr. Brown. Laura Lyle, CTV.
Sorry, you guys, no follow-ups today?
Thank you, Bruce. This question is for Premier Higgs. Premier Higgs, can you tell us how many tickets have been issued by enforcement officers for non-compliance in the last, say, 2 weeks or so, or since we entered the orange phase?
Yes, I can, actually. In the total number, if we looked at between, let's say, November 20th and 28th, there were a total of 2,500 sites that were actually visited. A total of 87 tickets were issued related to non-masking. 45 in Zone 1, 40 in Zone 2, 2 in Zone 3. A total of 38 tickets were related to businesses for other COVID-related matters. There were 17 of those in Zone 1, 21 in Zone 2, and none in Zone 3. So, I was very supportive of our surveillance of following the rules. And I certainly, as I said a little earlier, I certainly commended our officers for their diligence. And I know it can be disrupted, but I'm asking for patience here because we are right on the cusp of the end phase. When Dr. Russell talks about the other provinces, you just got to look around us. So the fact that we have over 1,000 people contacted and in isolation or self-monitoring, maybe more like 1,500, there's still those cases, but they're contacted. At least we know. The ones that we're seeing coming through are either travel or we know. We had a bit of a community issue in Moncton. But the idea right now is that we have this, public health has this, our enforcement people have this, our healthcare workers in general have this under control. So let's not lose it. And I know it's annoying. I know let's use our common sense in how we manage and with the public health rules, because wearing a mask is a small price to pay to ensure that we are able to take a vaccine and do it in a yellow phase and then go directly into green.
Thank you, Premier. Thank you, Ms. Lau. My apologies. I did say in French that it was one question per reporter today. I apologize for that. So it is one question. Jean-Philippe Hugues, Radio-Canada.
Oui, excusez-moi du délai. Ma question est pour Mme Russell, mais aussi pour M. Higgs. Le Québec vient tout juste d'annuler les rassemblements de Noël pendant les fêtes. Est-ce que c'est un scénario auquel les Néo-Brunswickois doivent se préparer si les zones 1, 2 et 3 demeurent en orange?
Tous les renseignements qu'on vient juste de mettre sur le site web sur qu'est-ce qui va être permis pour les célébrations des fêtes dans chaque zone, chaque phase sont écrits. Alors, le guide nous dit que dans la phase jaune, dehors, ça serait, avec la distanciation physique, ça serait 50 personnes qui seraient permis dehors ou moins. Et à l'intérieur, ça serait 20, jusqu'à 20 personnes si c'était le niveau jaune. Mais vraiment, mes médecins hygiénistes en chef n'ont pas hâte à les fêtes de Noël parce qu'ils sont vraiment... Ils sont vraiment inquiets que ça pourrait causer des éclosions après Noël, alors après les fêtes. Alors, on veut vraiment que les gens limitent leurs contacts étroits le plus que possible.
Ma question était pour la saison orange.
Bien, j'espère qu'on n'est pas dans le niveau orange dans ce temps-là. On ne peut pas prévenir ça à ce moment-ci, mais je vous dis que cette information, c'est sur notre site web aussi, dans tous les niveaux orange. Alors, orange, c'est vraiment juste les bulles d'un ménage. Alors, si c'est quelque chose que vous voulez faire dehors, vous pouvez planifier une activité dehors avec la distanciation physique avec 10 personnes.
Merci, Monsieur Hugh. Thank you, Dr. Andrew Watt, Telegraph Journal.
Premier Higgs, you said our complacency led us back into the orange zone. Looking back on it now, do you think there should have been tougher enforcement earlier to prevent this from happening? Do you think you sent a strong enough message to New Brunswickers, before all this happened?
Well, we can always look back in the mirror and say, if we could we or should we have done anything differently. The whole process from the beginning has been somewhat of a balancing act. And I think what we're seeing right now is people are COVID weary. They're tired of being in a pandemic. We're seeing it in other cities and other provinces and in the U.S., where people are just outright rebelling and saying, I've had enough of this. So there's always the balance. And here we are right now where, we could be doing the 100-yard sprint and we're at the 90-yard point and we're saying, I've had enough of this. I'm tired of running. So I'm just going to stop. So we're trying to balance it and say, look, we're trying to keep the economy moving. We're trying to allow people to do what they do every day, just with a little different format of how they protect themselves and each other. And I think the results have shown a very effective process that's been a culmination of many efforts by many people, as I've often said. So, if we could have, would have, should have done something differently, well, look around us. We've done quite well. And I want to be able to continue that. But this isn't a singular effort. This is a combined effort. And we need to all be in it together to the finish line. And the finish line is right in front of us.
Thank you, Mr. Watt. Thank you, Premier Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, if I heard correctly, Zone 1 and 3 are being reassessed to return to yellow on Sunday. I'm just wondering, what criteria are you looking for Zone 2 to meet to qualify to be reassessed to return to the yellow phase of recovery? And are we still seeing cases this week that are related to the super spreader event?
Well, the only reason we weren't planning to reassess Zone 2 is just because we did have a conversation today about Zone 2 and following very closely the situation at the Shanix. And so we still have some more testing to do in the next several days. So again, we wouldn't be ready to reevaluate just yet. But certainly for Zone 1 and Zone 3, our risk assessments are always based on the triggers, but they do take into account other factors. But the main triggers that inform our discussion and inform our decisions are the triggers document. So again, what got us to orange, we monitor whether all of the measures that we've put into place thus far are working. Are we seeing transmission after the measures were put in place? Because in the Zone 5 outbreak, after that 2 weeks, that first 2 weeks in orange, we reassessed and saw that there was still transmission occurring, in that all of the factors that were driving the transmission hadn't quite been addressed at that time, and we needed to do more to get the outbreak under control, which included more messaging, more education, more inspections, and really limiting people's close contacts. So in every situation, it's different. But Sunday, we will reevaluate Zone 1 and Zone 3.
Thank you, Ms. Hogarth. Pascal Rochenotte, l'Acadie Nouvelle.
Et bonjour, ma question est pour la Dr Russell. Le ministère de l'Éducation a annoncé aujourd'hui que le congé du temps des fêtes ne sera pas prolongé. Le ministre Cardi a expliqué que la santé publique lui a dit que ce n'était pas nécessaire, que ça n'aiderait pas à freiner la propagation du virus. J'aimerais juste comprendre votre point de vue là-dessus. Selon vous, est-ce que la prolongation du congé des fêtes aurait effectivement pas eu grand effet?
Non, pour les gens qui vont à l'école ici au Brunswick, maternelle jusqu'à 12e année, ils sont ici à l'intérieur de la province. Si des individus reviennent d'un voyage, il faudra qu'ils isolent il faut leur auto-isolement pendant 14 jours. Je sais à les écoles, à les universités et les collèges, il y en a qui ont eu un extra des semaines additionnelles pour s'assurer qu'ils pourraient faire leur auto-isolement à cause de leur voyage, mais avec les écoles ici au Nouveau-Brunswick comme tel, c'était, si c'est, oh my, je peux pas finir ma phrase. Le changement des vacances de Noël, des fêtes, pour les écoles jusqu'à 12e année, c'était pas nécessaire, sauf que s'il y avait une éclosion, et à ce temps-là, ça serait fait à le niveau individuel, à l'école, à le niveau d'école.
Merci, Doctor. Savannah Odd, Telegraph Journal.
Hi there. My question is for Dr. Russell. In the provincial guidance for long-term care homes in an outbreak, it says temperature checks have to be done when workers or visitors are coming in. I'm wondering if rapid tests are being used in that situation, either with or in place of the temperature checks. And if not, could you just elaborate on the situations where rapid testing is being used? Because the guidance on testing I'm able to find doesn't actually make any mention of rapid testing. So if you could just elaborate on that, that'd be great. Thanks.
Great question. So you're right, for visitors, et cetera, and staff, that they're not provided with rapid tests unless it's assessed by the medical officer of health who's in charge of the outbreak, that determines that. And that's usually done in a setting where they need the information very quickly, just because if the person was at risk of having many, many close contacts that either need to be isolated or cohorted, whether that be staff or patient or clients or residents, then that would be the case that it would happen. I believe the only other case that it was happening is when there was a bit of a backlog. Then I think in one of those situations the medical officer would have used it for that reason. But for the most part, it's higher risk at the beginning of the outbreak to make sure they're not missing anybody in that first round of testing. Because once they do the first round of testing, they do the isolating, the cohorting, et cetera, making sure which staff people are isolating and who are test positive, then they will then after that go every second or third day and do the regular PCR test after that.
Thank you, Ms. Odd. David Coach, Times and Transcript.
Hi, for Dr. Russell, senior officials at both Vitalite and Horizon have described a healthcare system that was already overstretched, now further strained by the pandemic. Where has the pandemic taken the greatest toll in the healthcare system, and what resources are being deployed to address it?
Well, that's probably a better question for Vitalite and Horizon. I can say that my contact with the with Vitalite and Horizon have been through planning for outbreaks, et cetera, whether it's with long-term care facilities and social development, whether it's the effect on hospitals directly related to COVID with respect to capacity. I know that during the red phase, the initial wave of COVID-19, that the exercise of emptying the hospitals, making sure that ALC beds were freed up to really assess the capacity of how many beds, how many ICU beds, and how many ventilators. That was a great exercise to have done. But what we learned from that exercise after the fact was that all of the delays of surgeries and other types of services that had been put on hold created a backlog of trying to catch up to those services. And so moving forward, what we knew we needed to do, separate from outbreaks of COVID, was manage the capacity of each hospital in all the zones, so that at any point in time, if there had been a surge in COVID cases, that they would have that capacity in the ICU, they would have that capacity in the hospital. You are right that prior to the pandemic, that my understanding is health resources were an issue, but that's not new, and we've certainly taken that into account in all of the managing and all of the planning that we've been doing. So you will see that, you know, keeping the highest level of inpatients and services that we can, while balancing that with the need to be able to adjust to surges in communities is really important. And that's monitored very, very closely by both RHAs when there's outbreaks and even when there aren't outbreaks. But certainly the collaboration through the Pandemic Task Force and through the leadership of both Horizon and Vitalite has been key to being able to keep everything afloat and keeping all of those things going and being very judicious about the resources that we do have.
Thank you, Mr. Coach. Thank you, Dr. Marie Sutherland, CBC.
Hi, my question's for Dr. Russell. CUPE says some kind of administrative leave pay is needed for healthcare workers when they're asked to self-isolate, or if they start to experience symptoms and are faced with the choice of either hiding their symptoms and going to work, or reporting their symptoms and staying home with no pay. I'm wondering, is this something the government will consider or is considering, and if not, why not?
I don't have a specific answer for you. I am aware that in a general sense there are some situations, not necessarily with healthcare workers, but other settings as well, where it is difficult for people to self-isolate and stay home when they're ill. And so I agree that that is a challenge. And my understanding is there probably have been discussions on that topic. I don't have an answer for you today, but I can get back to you with that.
Thank you, Ms. Sutherland. François Leblanc, Radio-Canada.
Oui, bonjour. Dr. Russell, la Ligue de hockey junior du Québec a parlé récemment qu'elle voulait tenir des matchs dans ce qu'on appelle des environnements protégés, là, plus on dirait probablement des bulles. Je me demandais si la Ligue vous avait approché, si vous étiez ouverte à voir s'il y avait un plan de format de bulle, comme la Ligue nationale a fait, ou encore comme la Ligue junior majeure a fait à Québec récemment.
J'ai pas fait partie des conversations récemment, mais ça se peut que le premier ministre pourrait répondre. Non, il dit non plus. Alors, pour maintenant, c'est pas quelque chose qu'on va changer, mais c'est une bonne question. C'est quelque chose qu'on peut revenir dans les prochaines semaines ou mois.
Merci, M. Leblanc. Derek Haggett, Times and Transcript.
Hi, my question is for Dr. Russell. Yesterday, the Center for Disease Control in the U.S. said some 2-week COVID quarantines could be cut from 14 to 10 or even 7 days. A 10-day COVID quarantine period is listed on Public Health Canada's website as a potential option. Is there any discussion about cutting the isolation period down 14 days in New Brunswick? And if no, why not?
Well, we did read that piece of information, and my team is studying it right now. It's not a new concept. That concept has been discussed several times in several different venues throughout the course of the pandemic. Thus far in Canada and in New Brunswick, we haven't really felt confident that we could reduce that. Other jurisdictions have.
even within Canada, but we are really going the extra mile in terms of being as safe and secure as we possibly can, because it is a numbers game. It is a 14-day self-isolation. And yes, you could be quite confident to catch the majority of people by the day 10 timeline, and we do day 10 testing, and we do find cases turning up positive at the day 10 of their self-isolation. But there still are some people who come back positive on day 12 and later. So again, we are erring on the side of caution at this point. We are going to review that information again with the public health team, but I don't see a move to making any changes at this point in time. We are trying with our testing strategy around workers who travel in and out of the province to try to make that as safe as possible as well with the testing regime. So it's not something that we are not, it's not something that's new in terms of the idea, and we can certainly revisit it as the pandemic has been an ongoing issue in terms of learning opportunities and taking those learnings and applying them. We were always open for new information and analyzing it.
Thank you, Mr. Haggard. Thank you, Dr. Harry Forrestal, CBC.
Thank you, Bruce. This question is for the Premier. Premier, I'd like to take it back to an earlier subject for just a moment. You said some time ago that you had asked landlords to refrain from rent increases aimed at emptying properties for the purposes of renovation or other uses. CBC has carried a number of stories of tenants whose rent has been increased by 30%, up to 50% or more. What indication have you had that landlords have acquiesced in any way to your request earlier? And given the public health appeals we're hearing every day to reduce contact, is this the environment you want people forced out of homes to find you accommodation?
Well, Harry, as I said earlier, the stats that we've seen would suggest that the eviction rates during the pandemic have been very low. So we've asked for details on that, but looking at the overall stats, they're less than previous years. So I know you as you report, you have some particular cases, but I've asked for an evaluation from, and I've asked on the landlords as well, their association, to give me details on rent increases and evictions particularly, so I have a very clear understanding if it's an issue or not. Because I expect landlords to do the right thing during the pandemic, and that would be that you wouldn't be, making it unreasonable. You wouldn't be doing things that are totally untoward or things you could either have options to do differently, and put someone out in a pandemic. So I will have that information from the landlords so I can assess it directly.
Thank you, Mr. Forrestal. Erica Butler, CHMA, Sackville.
Hi there. This is a question for Premier Higgs, and it's about enforcement. I'm not sure if the numbers that you quoted today include tickets issued by public safety officers as well as those issued by police officers. But I guess what I'm actually really wondering is if you have given direction to those public safety officers and police officers as to when to hand out compliance orders versus when to hand out tickets for non-compliance. I'm thinking in terms of local businesses. So the idea being, should they be first handing out a warning to tell people how to comply and make sure they're complying and give them a deadline, or should they just be hitting them with a ticket? Or, can you imagine a scenario where it would be appropriate to give them both of those at once?
Well, firstly, this includes all enforcement. So the numbers that I gave the statistics on were based on enforcement of any particular group, and it was during the orange phase of these latest 3 zones. So, but if you look at the ratio of our total number of like 2,500 sites, and that there were actual visits have been conducted, and we have a total of 87 tickets. If you look at businesses, a total of 38 were included in that. So out of 2,500, we've had a total of like 140 or 120 actually tickets out of 2,500 visits. So in that sense, it's like I certainly didn't give any instruction related to specific infractions. But what we have asked our safety officers to do was look at the rules that we have, particularly under Zone Orange, and ensure that the rules are being followed. And, you know, that's something that, whether it be a police officer, safety official, safety officer, or public safety, it's what they do every day. So they're well trained to be looking at infractions to the rules, and all our instruction would be is that we have emergency order rules that we need to follow in order to ensure that the individuals are protected, and that we can ensure that the pandemic does not get out of control. And, you know, I'm pleased to say thus far, that's the situation we're in. The pandemic is not out of control, and people are being protected because everyone's doing their job. So I certainly don't fault them for doing their job.
Thank you, Ms. Butler. Thank you, Premier. Marie-Ève Arsenault, Radio-Canada.
Oui, bonjour. Ma question est pour le Premier ministre Higgs. Les gens qui veulent entrer au Nouveau-Brunswick reçoivent souvent des messages contradictoires, que ce soit à la ligne d'information ou des agents à la frontière. Donc, quelle garantie pouvez-vous donner aux gens qui veulent entrer au Nouveau-Brunswick pour voir un être cher et qui comptent respecter les règles, qui ne se font pas refouler à la frontière?
Well, I think we have a situation where everyone is asked to register who needs to come, and we have even in the current levels of orange, there are for compassionate reasons that are identified in the orders. So if they're registered, they will have they will already be known to be traveling, and they will be recognized as such when they arrive at the border, and they will be allowed passage, and that passage will be identified what it is. So I think that system is well set up. It was well set up before in any level, but it's even more routine now because we've been at it for a while.
Merci, Marie-Ève. Geneviève Normand, Radio-Canada.
Yes, my question is for Premier as well. I was wondering, Premier, if the location has been determined with regards to where the vaccine will be administered in New Brunswick. And also on that topic, I was wondering how, do you feel that you're getting all the information needed at this point from Ottawa?
So firstly, in relation to where it'll be located, as I mentioned, Greg McCollum, our Director of Emergency Measures Organization, is coordinating the activity with us, working with the federal officials, working with the military, as we lay out the requirements for logistics. However, before we can do any of that, we need to know exactly the quantities that we'd be receiving and when. And that is unknown, so I don't know that. I do have another call tonight with my colleagues, and maybe more information will be provided. We did hear some indication of some trial run being done in December. However, any communication that I've had with the PM and my colleagues across the country, it's been related to rollout in between January and March. We would be identified with how many samples, how many vaccines we'd actually be receiving. At this time, we think it's somewhere in the order of 60,000 on a per capita basis, but that has not been confirmed. The exact dates have not been confirmed. I do have a call tonight and another call tomorrow with Minister LeBlanc. So I'm confident we'll get the information and we'll be able to work through the logistics of delivery. I feel equally confident about that.
Merci, Mademoiselle Normand. François-Pierre Dufault, Radio-Canada.
Good afternoon. My question would be for Premier Higgs as well. Nova Scotia is reporting 11 cases today. 2 of them are in the northern part of the province, which means that the outbreaks that we've seen in the Halifax region, some of it might be moving north closer to the New Brunswick border. So just wondering if you have any plans to tighten the controls at the New Brunswick-Nova Scotia border and the one with PEI as well, and if you have any plans of tightening them even further in the lead up to the Christmas holidays when people will likely be traveling between all maritime provinces.
I will just answer the part that involves public health, and then I'll turn it back over to the Premier. We do risk assessments of the Nova Scotia situation regularly, And the last conversation we had did not indicate that we were going to need any extra border measures at that time, but we will continually reassess that because it's not just about the risks themselves in terms of community transmission, which we are very concerned about. And we don't want to see that pop up here in New Brunswick, but we know it is possible. We have seen some community transmission related cases in the Zone 2, Zone 1. And again, we're on the lookout for that, and certainly the measures that we put in place around non-essential travel to Nova Scotia at this point in time, and anybody who's coming back from Nova Scotia has to self-isolate for 14 days at this point in time unless they're working. They're working.
Yes, I don't have much to add to that, obviously, because we'll work with public health to understand the risk. But at this point, having all requirements of a 14-day isolation for anyone coming back into New Brunswick, and I know it's on the honor system. I know we don't have a border control set up, and it's not our intent to do that at this time. It's hopeful that we will not be able to get to that situation. However, we put back the 14-day isolation for anyone that was coming into the province, and with the caveats around essential services. And if we have to go further, we will.
Merci, Monsieur Premier Ministre. Isabelle Leger, CBC.
Hi, my question is for Dr. Russell. Would there be any reason why a university student might be denied a trip home if they're moving between health zones in New Brunswick? And are students from Halifax able to come home for Christmas break?
Well, anybody traveling for non-essential reasons has to self-isolate for 14 days, regardless of who they are. And so there's that. What was the other part of your question? Sorry?
Within New Brunswick, if a university student was wanting to come home for Christmas and they're within New Brunswick but traveling to a different health zone, so say it's like a student in Fredericton, for example, going to St. Thomas, wanting to travel to Moncton to see their family for Christmas, would they need to self-isolate or would they be denied going there at all?
Well, we're not enforcing the non-essential travel recommendation. We're strongly urging people to not travel for non-essential reasons. Obviously, right now, between the 3 zones that are in orange, we would not want people traveling between those zones. We wouldn't want people traveling in and out of those zones other than for essential reasons. So, but there would be nobody enforcing you to stay in a particular zone. It's a strong recommendation that we urge everyone to adhere to, because that's how we're going to keep these outbreaks going in the right direction so we can all get to the yellow phase before Christmas.
Thank you, Doctor. Thank you, Ms. Leger. Before we terminate, I just want to point out a clarification. A telephone number was read earlier. The correct number is 1-888-298-8555. Un point de clarification, le numéro qui était annoncé plus tôt, c'est 1-888-298-8555.
That concludes today's COVID-19 news conference for New Brunswick with Premier Higgs and Dr. Jennifer Russell. Just for a recap, we have 6 new cases today, 3 of which are in Zone 2, the St. John region, 2 are in Fredericton region, and 1 is in the Moncton region. We did learn today that Zone 1 and Zone 3, that's the Moncton region and the Fredericton region, will be reassessed on Sunday, so we will find out Monday whether there is a rollback to yellow or not at this point in time. Zone 2, the St. John region, however, will take longer before it qualifies for reassessment. I believe that's because, as Dr. Russell mentioned, that was a question I asked on behalf of Zone 2, is when will we qualify in this region to be reassessed to roll back to yellow? And she mentioned that the Shannock situation has still not yet stabilized, so once that situation is under control, perhaps by then we will be able to qualify to be reassessed. That's all the news for today. I will join you again next time. Thanks for watching.